good afternoon. My name is Kimberly Wasserman, and I am here today representing the LVJO Public Transit Campaign, its members, its leaders, and its lead organizer, Michael Petula. And I'm also here as a proud member of Transit Riders for Public Transit. So we're here today because in Chicago in the past year, we had a $213 million gap in public transit services. And at a fare of $2.25 one way with no cash transfer, we have a lot of folks in our communities who can no longer afford to take the bus or the train for that matter. And many of our folks are having to leave not only their cars behind because they can't afford insurance, gas, maintenance, but they're also having to make a decision about whether or not they can even get on the bus to go out and look for employment to be able to get to their jobs. Unlike some of the communities that are here today, we're very fortunate as a community. We have a lot of the things that we need within our community. We have clinics, we have doctors, we have a lot of the basic necessities, but we don't have access to higher education. We don't have access to jobs outside of our community, specifically industrial jobs, specifically jobs in hotels, restaurants, and some of the larger workforces outside of the suburban Chicago area. So public transit for us is a huge job accessibility issue. And again, as the economy gets worse and there are less and less jobs, and we have folks taking the bus to and from to be able to just apply for a job, go and get unemployment benefits, get in line for food distribution days, or even take their kids to the free health clinic. We're having to tell them that you can't take the bus on any time after 4 o'clock because it doesn't run anymore. So if your kid gets sick, try to make sure that it happens before 4 o'clock. Otherwise, you're going to have to wait till the next day. Or if you're lucky enough, maybe you can call an ambulance and not pay to have your kid taken to the hospital. So when we're talking about a reversal of funding, it's not just because it's our civil right to be able to take public transit. It's our basic human right to be able to take transportation to and from when the necessity needs it to be. If it's going to get a gallon of milk, if it's going to the hospital, if it's going to do whatever it is that our daily lives entail it to do, we have that basic fundamental right. Now, in regards to the cost, it's amazing that in order to get to work for a minimum paying job, you have to work an hour to basically pay off your ride to work and home again that same day. Many folks are having to make that decision: do I pay for food or do I pay for my public transit card for this month? And that's not it's not right for us to put that responsibility on the backs of low-income communities of color. We're here advocating for more responsibility from the federal government to say, let's designate specific money for operating costs. Let's make sure that our folks who are at home struggling are not having to worry on top of their foreclosure issue whether or not they're going to be able to take the bus tomorrow. So we're here today because we recognize that Chicago is only one city out of many cities that are out there struggling, like New York, Boston, Atlanta, California. And we're here today to ask you to talk to us, to not just take the transit authorities or the planning associations, talk to the folks who are directly affected and figure out how else you all could be helping out in the situation. Because many folks who take the bus, who pay for that monthly transfer, understand the dynamics of what is happening and can be of use when it comes to developing any kind of language that is being presented for consideration. So I had a speech, but I just decided to not just skip over it just based off of today's activities. But the other thing I wanted to mention as well is that it's not just those of us who are able to walk and talk, it's also those folks who are disabled. In Chicago, the disability rate nearly doubled in the last year. So you're talking about people who are on Social Security benefits who can also no longer be able to take the bus or train and are restricted not just to their community, but to their home as well. Our buses, they just did an expose in Chicago, our buses are passing up people handicapped left and right because their ramps don't work. So you have people out on bus stops for 2 hours, 3 hours waiting to get somewhere. Or they just can't access the rail cars because the doors aren't wide enough for them to roll their wheelchair in. So they have to wait 3, 4 trains in to be able to get on a train. So again, this isn't just a question of, the able person being able to get around, but it's also our brothers and sisters who are handicapped and disabled as well. So thank you guys very much for coming today.